So this is the Transcutaneous Pacing Station. Jay's going to demonstrate how to prep the patient to prepare for external pacing. And then we're going to move to the front face of the monitor so Jay can walk us through the interface of using the machine itself.
Okay. So the reasons we would transcutaneous pace somebody is if they're in a bradycardic rhythm that's symptomatic, like a 3rd degree block or something would probably be symptomatic, we'd want to pace the person with. So the first thing we have to do is we have to identify that they're bradycardic or in a 3rd degree block, so we'd have to put our limb leads on. So I'm just going to place them. Leg. And there again, you cannot pace somebody if you do not have the limb leads on, because the monitor will not recognize your pacing. So. All right, so we put the limb leads on, and we notice they're in a bradycardic rhythm that's symptomatic. So then we would get out our pads, make sure the date is good on the pads, open the pads, and apply them. You know, we would making sure that the current is going to go through the heart.
So Jay, you're electing in the anterior lateral position.
Yes.
Is there another way you can place your pads?
Yes, we could put one on the front and one on the back. If the pads are bigger and the person's smaller, you can put one on the front and the back. You just have to make sure they do not touch.
Okay.
And you might want to think about pre-medicating the patient before doing this if they're alert enough.
Okay,
So
excellent.
we can see that they're in the 3rd degree block. So we would turn our pacer on, and it comes up automatic program to 60 beats per minute. I believe the protocol says around 80. So we're going to turn that up to 80, enter that. And now we're going to turn our milliamps up till we get capture. And there we have capture at 70 milliamps.
So how do you want to assess for capture after you have?
So after we have capture there, we want to make sure that we also have mechanical capture, which is driving a pulse. So we're going to check for a pulse on the patient. Make sure that the pulse matches what the machine is doing. So they're both good. They're even.
After you gain electrical capture, would you want to consider increasing your milliamp setting at all?
Yes, by 10%.
And why is that?
To make sure you maintain capture, you don't fall out of capture.
When you move the patient. Okay, excellent. Good work, Jay.
Okay.